my name is Erica, and today we'll be demonstrating an IV med via mini bag. So our patient today is Emma Wrightson, and she has no allergies. And I've compared the MD orders with the MOR, and everything matches already. And we see that there's a normal saline IV at 25 cc's an hour. So we'll check that when we get in the bedroom. Okay, so Emma Wrightson, no known allergies, and I'm just going to perform hand hygiene before I grab my medication from the Pyxis machine. So I have Emma Wrightson, methylprednisolone, 50 milligrams, and this is 125 mg vial, and it's to be given IV, and this can be given IV, given every 6 hours, and the time is now, and it has not been given yet. So that's good. Now I'm just going to look at the PDM. So we have methylprednisolone, it's a steroid. It may be administered by a nurse or student nurse. The maximum single dose in a day is 30 mg per kg, and we have 50 mg, so we're good to give this medication. We will reconstitute, since our vial is 125 milligrams, we will reconstitute with 2 mLs of sterile water with a final volume of 2 mLs and final concentration of 62.5 mg per ml. And it says it can be further diluted in 50 to 100 mLs of normal saline or D5W and administered over 15 to 30 minutes. And I'm going to administer it over 30 minutes since this patient has not received this yet, and in case of any adverse reaction. And a couple potential hazards to look out for are edema and increased blood glucose. So our patient today, Emma Wrightson, she was admitted she's 30 years old and admitted with a history of Crohn's disease. She presented to the hospital with increased diarrhea over the past 4 days and is now having bloody bowel movements. She has been admitted with a Crohn's exacerbation. Okay, so we've looked at that. So now I'm going to just swab the top of the vials, the sterile water, for 30 seconds and let dry for 15. And I'm going to swab for 30 and let dry for 15. Okay. I'm going to grab my syringe and my blood cell needle, sterilely attaching the tube. Okay. So now I need to grab my sterile water. So we have 125 mg's in our vial, so 2 mLs of sterile water. So I'm going to drop 2 mLs of air. Then I will put into the sterile water. So I have 2 mLs of sterile water. Now I can put that in my methylprednisolone vial that I've already swabbed and remove the air. So now I'm just going to mix the vial to make sure there's no sediments at the bottom. And I've already calculated my dose, so I need 50 milligrams of methylprednisolone, and the final concentration is 62.5 mg per ml. So my final dose will be 0.8 ml. So I'm just going to re-swab the top in case I touched it, the top while mixing it. So swab for 30, let dry for 15. Now I'm going to drop 0.8 mLs of air. Okay. So I have 0.8 mLs of methylprednisolone. So now I'm ready for my second check. So I have Emma Wrightson, no known allergies, and I have methylprednisolone. methylprednisolone, 50 milligrams, and my vial is 125 mg, so I reconstituted with 2 mLs with a final concentration of 62.5 milligrams per ml, so which gives me my final dose of 0.8 mLs. So I have that, 0.8. It's given IV. This can be given IV, and as per the PDM, it can be given IV, given every 6 hours, and the time is now. So I'm good to get this. And I've chosen a 50 ml bag of normal saline as per the PDM. So I'm just going to swab the port for 30 seconds, and I'm going to leave it dry for 15 seconds. And I'm going to check my medication. And dispose of this in the shards. So now I'm going to grab all my supplies for the bedside. And I'm also going to attach my label. So Methylprednisolone, methylprednisolone, 50 milligrams. The volume of medication is 0.8 mLs. With a final volume of 50.8 mLs given IV. This can be given IV every 6 hours, which is right now and right now. So I'm good to go. So I'm going to bring all of this to the bedside. And I'm going to make my way to the bedside. So, hi, my name is Erica. I'll be your student nurse today. I'm just going to perform hand hygiene, and I'm going to ask my patient their name and their date of birth. Okay, and I'm also going to verify with the armband. So Emma Wrightson, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9. Perfect, so that matches. I'm just going to do my third check before I give the medication. So we have Emma Wrightson, methylprednisolone, and the dose is 50 mgs and 50 milligrams. I have in here with the volume of my medication was 0.8 mLs, which I diluted in this bag. So the final volume is 50.8 mLs, and it's to be given IV. I have all my stuff to be given IV, and it's given every 6 hours, which is right now and right now. And then before I give this medication, I'm also going to ask my patient if she has any allergies, and she has no allergies, which also matches my bar, which is good. And I'm just going to double check no allergies. Okay. So now I'm just going to educate my patient. So today I will be giving methylprednisolone. It's a steroid for your Crohn's disease because you have bloody bowel movements. A couple things to keep in mind: if you experience any edema or increased blood glucose, just let me know and I'll come reassess. The patient does have the right to refuse, so if they refuse, she hasn't refused the medication, so I'm good to give that. Now I'm just going to assess the IV, primary IV. It's running at the correct rate. There's no kinks or air bubbles. I'm just going to assess the IV site. There's no redness, swelling. Are you in any pain? No? And I've already checked the compatibility with my primary solution, so it's compatible, so I'm good to give this medication. So now that I've assessed the IV site, I can lower my primary bag.
I'm going to put my third check. So I'm going to put my third check. Is that okay with you? He says yes, so we're going to put my third check.
And I'm going to take out my secondary tubing. And keeping both ends sterile, I'm going to uncap both and attach both
below. Right here.
So now I'm going to choose the pump above the Baxter pump, so it can be regulated by the pump. I'm just going to grab my alcohol swab. for 30 seconds and leave
If I were to
dry for
contaminate any
15
of these,
seconds,
I would
and
have a
keeping both
new
ends sterile, I'm
tubing, or I
going
would
to
have to
attach
prepare a
them.
new set of medication, but it's not the case right now, so which is good.
Okay.
I'm
Now I'm just going to vacuum
opening
the
over
roller
here.
clamp.
I'm actually going to be using the port which is right above the machine over here pump, so that it can actually the medication can be regulated by the pump. So I just for swab right now.
Okay. Perfect.
I'm going to swab it for
So
30
now
seconds.
that I have this ready, I can set my rate. So I've already calculated my rate, and since the final volume is 50.8 mLs, I'm going to set my rate at over 30 minutes, so it will be 102 mLs.
Put the tubing again over there. So it's right over there now. I'm going to find my tubing, so that I'm going to open my cap. And I see the bubbles going up right there in my tubing, right there. We want to dip the immerse to be full like half, so this will get and my second bag over here. This is perfect. I'm just going to have it up again. And I'm going to...
So my rate is 102 mLs an hour, and my volume is 50.8 mLs.
And then we need 254 mLs, that is our total volume. We're going to confirm primary, we're going to have fallback.
Okay,
yes.
so okay. So since I've done my calculations and the final rate will be 102 mLs an hour,
I'm going to have all that
that's
and
good to go.
come back and give a 15 cc flush. I will assess the patient.
So I've done that, and I'm just going to make sure that there's 3 hits going before I leave. And I'm going to program a callback so that I can program a 15 cc flush. And I'm just going to perform my exit safety check, make sure that my patient isn't in distress, call bell and reach, and the bed lowered, and then I'm going to document on the mark with my name, my initials, and my student signature with the time that it was given. I'm also going to document on the in and outs flow sheet.
Also, he had to wrap in the medication, but